facilities. There was one hospital in Australia that was swamped with patients only because during that heat wave, the reception area was cool and people just wanted to be there because of this very cozy admission room, no? So that can be one minor effect. But it can cause, as far as equipment and in the hospitals, it can cause hospital computers to overheat and fail, as experienced during the 1997 heat wave in Australia. And the increased use of fans and air conditioners may cause overheating in electrical supply cables and appliances. Likewise, heat waves can lead to water shortages and water supply failures. And these may, and likewise, transport systems, because with heat waves, there will be often indirect increased frequency of fires also. And this can sometimes affect transport systems outside of the hospitals. And this indirectly can have effect on hospital operations. Either the hospital employees, staff will not be able to report to the hospitals, or patients will not be brought to the hospitals on time. Floods. The flooding of the river Elbe in 2002 in Germany required immediate public health action. So floods can result in degradation of human health and loss of life, high financial cost, trauma, and human misery. And when healthcare facilities get flooded, electrical power outages may be unavoidable. So evacuation of patients will usually be needed. So flooding may also create access problems for physicians and other staff traveling to and from hospitals. Storms. So as a result, for example, in the USA of the recent 2005 recent Hurricane Katrina, there were some hospitals that were actually submerging water. So because of this, there were some hospitals whose patients eventually got evacuated, and 18 got temporarily closed. Storms may also potentially knock down healthcare facilities and wash away roads. So what are the recommendations of the two authors? Well, they have some immediate possible infrastructural recommendations, and this includes increasing public awareness, warning procedures for the community, thermal control, especially for heat waves, meaning opening the windows, or environmental control, like managing the smoke coming from potential fires, emergency firefighting response, and evacuation of those in immediate danger to safer facilities, to search hospitals or other facilities. And the long-term recommendations would be, of course, urban planning, health systems responses, and facility management. For WHO, WHO has been involved in the protection of health from climate change through the elaboration of various policy guidelines, frameworks that have been communicated and advocated to member states. WHO also convened several meetings on climate change, and the last meeting was done in Kuala Lumpur just last year. Okay, and there are WHO's work for climate change would focus on these 6 key areas: health security, strengthening health systems, health development, evidence and information, delivery, and partnerships. You will notice that these are not new strategies that we are espousing, because the problems brought about by climate change are not really something new. These are the same problems that we have experienced before, but this time, because of climate change, there's only a change as far as severity and frequency. Brought about by these meetings and initiatives, WHO came recently with a regional framework on addressing climate change, and this framework aims to at least do three things. One is to increase awareness of stakeholders about the effects of climate change and what they can do. The second one is to strengthen health systems, which includes surveillance system, disaster preparedness, and the delivery of essential health services. And the last one would be to strengthen partnership or networking with other sectors. And as such, we need to protect our health from climate change. And let's do something. Let's leave our children a living planet.
Thank you very much, Dr.